So I'm not sure if you guys can see all this hair in my shower from when I washed my hair this morning. But my shower walls are literally plastered with my hair because my hair comes out in clumps because of my bad thyroid. It's all over the place. All over the walls. Yep. Don't worry, I'm gonna clean it out, because if I don't clean it out, it's just gonna clog up the drain and make more of a problem for me. We've been in a rush today. Really big rush. I feel like the white rabbit from Alice in Wonderland right now. You know, you gotta go, gotta go, gotta go, or you're gonna be late. There's just so much going on today, and I'll break it down in just a minute. Just let me put myself together first. So let me bring you guys up to speed. Raise your hand if you have ever accidentally broken your spouse's glasses. Yep, I broke my husband's glasses. It was pure accidental, I promise. The struggle is right now trying to get them replaced. They're bifocals because he is a diabetic and he has diabetic retinal dysplasia. So they're specially crafted and specially made for his needs. Replacing them is actually the easy part. Getting into the doctor's office is the hard part. I have made several calls to get in. Nobody's answering. Nobody's picking up their freaking phone. What I'm trying to do specifically is that his optometrist will take him and his insurance will cover it, no problem. He needs a referral from his general physician to get in. It's all about referrals nowadays, folks. So I'm waiting on that. I've already spoken to the people at his optometrist office. They're on board. They said, let's go, let's get him in ASAP so we can get this done. Because my husband is legally blind without the glasses. So I'm waiting on the call from the GP's office. And if they don't, I'm going to call him myself again. Because I'll call your mama, I call your mama's mama, I call your mama's mama's mama to get what I need for my family. I mean, it's just that simple. But I gotta get grocery shopping real quick, and I'll see you guys in a bit. So I managed to get my husband's appointment taken care of. The earliest they can do it is the 26th. But, however, I get paid before that date, so whatever co-pays are involved, it shouldn't be that big of a problem. Now, his glasses are going to be pretty expensive because I've already discussed, you know, his diabetes. But this whole healthcare system for us is insane. For those of you who don't live in the U.S., those of you who live in Canada or England or wherever you have universal healthcare, it's pretty hard for us down in the States. Even though we have insurance, there's still co-pays, and sometimes our insurance won't even cover what we need. So we're usually having to pay out of pocket for what we have to get done. It's just insane, guys. It really is. So when something goes down, we have to really, really hustle and get it taken care of, and we can't let it fester. We just have to go ahead and get it done, no matter what the cost is. And thank goodness my daughters all have insurance. They're covered through a state program, so all their therapy, all their doctor's appointments are completely covered. It's free of charge, but I don't mean free because, you know, it's coming out of the taxpayer's pocket, of course. But it's taken care of, and we don't have any co-pays in that at all. However, for my we have co-pays, and sometimes we have to pay the full entire bill of whatever the situation is. It sucks, but it is what it is. Which is going to bring me to another interesting topic. In my experience with getting appointments and getting heard with doctors, sometimes women aren't taken as seriously as men. Now, whenever my husband needs something regarding his diabetes or regarding his health care, he gets it done like that. Women, for a while now, aren't taken as seriously as men because biologically and genetically we are just different. We're a different gender. And they're doctors use all kinds of excuses like, oh, it's that time of the month, or she's hormonal and that's why she has these symptoms. So it takes us a really long time to get in and get what we need and to do what we have to do. Prime example of this. I've had migraines all of my life. Mostly when I was about 12, 13 years old, I started to have really, really, really bad migraines. So when I was about maybe 15, I was seen by a neurologist. Of course, everything was fine. They just chalked it up to, puberty and hormones and stuff like that. Well, my migraines kept getting worse and worse and worse and worse and worse. Still, nothing was wrong with me. Finally, when a few years ago, when they said that my thyroid was completely, or almost completely gone, it's a total wasteland. Migraines in puberty in teenage years are actually a sign of lowering thyroid levels. Nobody, when I was younger, nobody thought to check my thyroid levels because, oh, she's too young for this symptom, or she's a female when it's, she's going to get her period, for the sake of the conversation, because we're mostly adults here, right? So, a lot of the time, especially with my aunts, I've seen the same thing. I have an aunt who has PSTD, she has fibromyalgia, she has RA, and she has a hard time getting, or she had a hard time getting her appointments before all of her diagnosis because she was a female. I think that our healthcare system is gender bias. So it's a hard word out there for us ladies already, and it's not fair the way we get treated medically. So it takes a while for us to get what we need done because we're not taken seriously. So I know this vlog is going to be kind of short because my keyboard actually took a freaking dive. But I have to edit everything on my phone using a really awesome app I found, and I'm going to upload it on YouTube after I'm done editing. So I'm going to have to use my phone until my keyboard dries out, or have to buy another one, whichever comes first. Keyboards are cheap, so I'm not too worried about it. So I will see you guys later. Bye.